Hi everyone, it's Carla theBubblelush, and this is my week 13 pregnancy update. First I've got to say that for the first 12 weeks of the pregnancy, the only thing I was looking forward to was hitting the magical week 13 and knowing that I'm safely in the second trimester. So the day that I hit 13 weeks was a huge day for me. It felt like a personal victory or something. It felt like I just completed this huge race when I'm really only starting it. But it just feels really good to hit 13 weeks. I'm now much calmer about the pregnancy. Not that I've had any reason at all to stress out about it. It's been a really easy pregnancy so far, and I'm very thankful for that, but I'm really thankful to now be in the second trimester. So, and those of you that have been here before know exactly what I mean, and those of you that are newly pregnant, you know what I'm talking about. You just want to get to the second trimester and have everything be safe. So, as far as week 13, the baby is now the size of a peach, which is so amazing. It's about almost 3 inches long, and it almost weighs an ounce. It's almost there. The baby can now make a fist and suck its thumb, which I know it can do because we saw it happen on our NT scan, which I'll talk about later in this video. So it can make a fist and it can suck its thumb, and the bones in the skull, they're all solidifying and becoming harder, and ribs are forming. We started seeing ribs on the NT scan as well, so that was, little baby ribs are like the cutest things ever. I'm reading off of a list here, so. Oh, the intestines, you know how they were forming like in the umbilical cord? Now they have completely moved into the abdomen. So that's good. And the baby's tooth sockets are now totally ready to produce teeth when the baby is 6 to 7 months old. So it's kind of crazy to think that like all systems are go. It's just kind of crazy. And there's still so much time left. So another huge milestone is that the vocal cords, they're like ready to start crying, which right now that seems like a huge milestone. I'm sure when I'm awake at 3 a.m. with a screaming infant, I'm going to be shaking my fist in fury at week 13, but I guess it had to happen sooner or later. As far as me, I feel great. I feel absolutely great. Morning sickness is gone. Exhaustion levels are not nearly as bad as they used to be. You remember, I couldn't even make it through a work day. I'd have to take a nap in my car at lunch, which is pathetic, but I just had to do it. And my concentration was all over the place. Now, if I have a task that I'm really interested in and I'm focused on getting done, my mind isn't wandering as much. So that's really good, and I should probably take advantage of it while that lasts, because mommy brain has not been as bad lately either. My appetite is back, but I still haven't gained any weight. I'm still down 9 pounds from Christmas when I found out. I'm not dieting. Someone was yelling at me that I shouldn't be dieting while I'm pregnant. I'm absolutely not dieting. The thing is that I just can't eat that big of meals. I get really full. Like for example, my friend was up here, so we went and got a pizza. One of those pizzas that you like pick up and then you bake at home. I ate 1 slice of pizza and I was absolutely stuffed. And I can usually put away more pizza than that. So my serving sizes are just so much smaller before I get full. So I try to eat multiple meals throughout the day. But I guess it's just the higher metabolism, and I'm drinking a lot of water because I'm always thirsty, so I just haven't gained any weight yet. And I really shouldn't, because, you know, the baby doesn't even weigh an ounce. So the only weird thing that I have is I have this, and I don't even know if it's a pregnancy thing or not, I just have this like constant tickle in my throat. So I'm drinking apple juice right now. Excuse me. Okay. So, the NT scan. I got a call the morning of the Nuchal translucency ultrasound saying that one of the sonographers, ultrasound techs, had called out sick So she asked if I wanted to reschedule, and I said no. I'll wait in the waiting room as long as I have to, but I want to see the baby today. I had already waited 6 weeks since I had seen the baby at 6.5 weeks, so I was ready to see the baby. I also didn't want to have to take time off work. It's just kind of inconvenient getting to my doctor's office from my workplace. And so it was better to do it on Mondays. I don't work on Mondays. I work a full-time job, I just don't work on Mondays. So our appointment was like an hour late, but they took us right back once my name was called. We went right into the ultrasound room. And for those of you that went through fertility treatments, and as much as you're used to vaginal ultrasounds, they just kind of suck. No one likes them. It just felt so amazing to have an abdominal ultrasound for once. It felt real. I don't know. It was just interesting. You see, like on movies, and they take out the lube and they put it on your tummy, and they put the little transponder on your tummy, and that's the experience I had, and it was just so amazing. So, as soon as she put the probe on my stomach, we saw the baby, and the baby was jumping and wiggling all over the place, and it was the cutest thing I've ever seen. She had to do some measurements of my uterus and my ovaries, make sure everything looked good. So she's like, I'll go right back to the baby, but it's in there and it's moving. We were like, okay, good. So my ovaries looked fine. There were very few cyst follicle things on them. They looked really great, actually. My uterus looked fine, and the baby was perfect. Let's see if I can find the stats. Sorry, I should have had this pulled up. Okay, so I had the ultrasound done when I was 12 weeks and 4 days. For those of you that don't know, the NT scan, or the Nuchal translucency scan, it measures a pocket of fluid behind the neck, and you want it to be less than 2 millimeters to be considered normal. If it's abnormal, if it's thicker than that, it could be a possible indicator of Down syndrome or trisomy 18. So they do this ultrasound, and they also do a blood test. So that looks for your risk factors. Let me go down to when I have... Oh, so the baby, I guess the baby was laying where she or he, I don't know the gender, the she or he was facing straight out, and so we couldn't get the tech couldn't get a really good look at the nuchal fold. So we got to look at the baby for a long time trying to get the right view and right angle. Occasionally she would put the transponder on my stomach and shake it vigorously back and forth, and it was so cute because we could see the baby on the screen, and as soon as she would do that, the baby would throw both hands over its head and like cringe, and as if it was screaming earthquake. So it was just really cute to see it responding. So she was finally able to freeze a really nice shot of the profile, and the nuchal fold was 1.6 millimeters. It's in the 64th percentile and considered completely normal. The crown rump length was 6.65 centimeters, or 2.6 inches, and that's consistent with 13 weeks, so here she is still measuring big, but now she's measuring 3 days big instead of just 1 day. Since it's less than a week difference from my estimated due date, they decided not to change my due date. But since I'm due like September 2nd, it might come in August. And the heartbeat was 153 beats a minute and was absolutely precious. So I'll put some pictures in this video. I got some really, really cute ones. The arms looked great. We didn't get really great shots of the legs, but the baby was so cute. It kept floating down and then like pushing off the bottom and floating, going all the way to the top and like almost hitting its head. It was like jumping up and down. Cutest thing ever. If you're friends with me on Facebook, my Facebook name is Carla, last name theBubblelush. The profile picture from the NT scan is my profile picture, and it's just like the cutest baby ever. I think, at least, but I'm totally biased, I know that. So, that's about it. The NT scan went great, everything was normal. Now I'm going to do a 14-week update and talk to you about my first midwife appointment, and I guess kind of what's going on. Bye, guys.